More employers are looking for ways to bring wellness into the workplace. I'm Jeanette Pavini, and in the long term, well, that's going to help with healthcare costs. In the short term, employees are getting healthier and having some fun.
You guys ready to kick it up a notch?
It's noon at the California Department of Public Health in Richmond, but these employees aren't working through their lunch, they're working out their quads. Instead of crunching numbers, they're crunching abs. And rather than stepping into a meeting, well, they're stepping across the field. It's all part of the Bill of Good Health, a program designed by Blue Shield of California for all the employees at the Richmond campus.
We all committed that we would leave our desks and get outside and do some good exercise.
Holly Howard is just one of the 150 employees who participates in the Work Fit program, an hour-long boot camp every Tuesday and Thursday.
It was really encouraged from up high, so we felt that it was something that our senior executives would support fully.
Support from people like Kathleen Billingsley, Chief Deputy Director for the California Department of Public Health.
Blue Shield did a great job of engaging a really highly specialized group of individuals.
But it didn't start with boot camp. To get this ball rolling, Blue Shield hosted a series of free on-site biometric screenings, and 78% of employees, that's 943 people, participated. For many of them, it was a major wake-up call.
I learned that I had diabetes and that I had hypertension and that my cholesterol was all wrong. I'm quite sure that I would never have discovered I was diabetic until it was too late.
After getting those results, a co-worker encouraged David Cottam to make his first doctor's appointment in 10 years. Since then, David has lost 30 pounds, exercises 2 to 3 hours a day, and is officially off diabetes medications.
It's a win-win for every employee who sees that their organization is committed to their health and willing to invest in their health. And then in the long run, this really helps each organization become stronger and better.
Deputy Director Dr. Paul Kimsey says it's also changing the atmosphere.
We have 1,200 people on campus. We can be very siloed in our day jobs, and this ability to interact with other people has really increased morale. Being the public health department, we know that these programs inherently work. We've seen the literature, we're involved with the Centers for Disease Control, and so we know that the benefits of these programs.
Tabitha Butler can attest to that. As a full-time working mom of 2, the opportunity to participate in Weight Watchers and boot camp during her lunch hour was crucial.
I'm able to get home and make sure the kids are doing their homework and cook dinner and not have to worry, okay, am I getting in my exercise today?
Since the program started, Tabitha lost almost 40 pounds, is off cholesterol medicine, and completed races with her kids.
The participation on the Richmond campus in the Blue Shield program has been overwhelming and very surprising and very beneficial to everybody that's been involved.
Here we go, we're working.
Having seen the success of this wellness initiative at the Department of Public Health, I would encourage others in state government and other organizations to invest in their employees and invest in wellness.
As more companies strive to make healthcare affordable, they're turning to their employees to become more active in managing their health. Bringing wellness into the workplace can make the difference in employees' adoption. It certainly did for the Department of Public Health Richmond campus, because as these programs came to an end, many of these employees took it upon themselves to continue working on getting and staying healthy.